The selection of the implant, as both size and type for breast augmentation, is probably the most important thing that we do, and also the source of the most anxiety for people. Many questions are related to implant size when I look online and answer online questions. One of the biggest things in the past that people talked about was volume, whether it's 300 cc's, 400 cc's, 500 cc's, or whatnot. And I think it's really important to take a more three-dimensional approach. I think volume is just one measurement, and I think it's almost secondary. The first thing that I think you have to think about is the width. The width of the implant has to match the width of the breast. Once we figure out the width that matches you, then we can pick the projection based on the look that you're trying to achieve, whether that's a moderate profile or a higher profile implant. Then we can almost secondarily back into the volume. And by taking a more three-dimensional approach, we can get much more natural results and much more predictable results. We have a sizing system that we use to help people select implants. I think that that's also important. It gives them a sense of what the implant's going to look like underneath a t-shirt. And I think that that's really allowed us to have results that we're happy with and have the best chance of having a happy person afterwards. I think that there's a couple things that we can do for your breast augmentation to try to minimize the recovery time. There's some long-acting local anesthetics that we use during the procedure that can diminish the early post-operative pain. That way we can make the procedure as easy as we can. If we can eliminate the early pain, then I think people are back on their feet faster. I don't do any heavy wraps or anything along those lines. When you wake up from your procedure, you have a bra in place. You can shower the next day. Most women are up and about the next day. Certainly within 2 to 3 days, they're able to drive and get along with their lives. And I think that if we can minimize the recovery time and make the procedure as easy as possible and as pleasant as possible, people are much happier. At the end of the day, that's the only important thing.